Morning everyone, I'm Jen, I'm one of the trainees here in Wessex. I'm going to talk about a national survey I undertook together with a group of trainees across 3 deaneries, looking at the impact COVID-19 has had on paediatric training. We designed an online mixed methodology survey which comprised of a mix of multiple choice and free text elements. Included within this, we asked trainees to describe their most positive and their most negative experiences, and these were analysed through dual code of thematic analysis. The survey was open to all paediatric trainees in the UK between May and August of this year, and respondents were anonymous. We were able to include 365 results in our analysis, which exceeded our recruitment target, which were determined based on a priori power calculation to be representative of UK trainees. As you can see from the graphs, we had responses from trainees across all deaneries in the UK and all training grades. We gained a real wealth of information from this, so I'm going to talk through just some of the key findings, presenting the themes we identified with some example quotes and linking these to findings from the group as a whole. So starting with the question, what were the more negative aspects in which COVID had impacted training? We identified 4 themes. These are training, safety, experience and well-being. Within the training theme, there were 4 sub-themes in that. So these are reduced opportunities, cancelled events, teaching, and progression. Trainees' concerns regarding progression related not just to ARCPs, but also to grid applications and delayed CCTs. For trainees that had concerns about their ARCPs, 2/3 of them felt that inadequate work-based assessments were going to be a factor in that. And there were also concerns expressed about lack of time and specialty, particularly for grid trainees and trainees on community rotations. Those that know the ARCP process will know that there were some new outcomes, outcome 10.1 and 10.2, introduced this year to recognise that there could have been impact from COVID. Our communication with the Royal College has shown that 4% of trainees achieved an outcome 10.1, and that meant they were not at a critical progression point and could progress to their next stage of training. Just 1% of trainees achieved an outcome 10.2, which meant they were at a critical progression point and additional training time was required. So that obviously had an impact for those trainees, but it seemed that the worries and concerns expressed by trainees with this process didn't necessarily bear fruition. The other sub-theme I'll talk about in this category is cancelled events, which was another big concern for trainees. 1/4 of trainees that responded to the survey had 1 or more exam cancelled. That does include START, sorry, I know that's an assessment, but that's included in that figure. And other cancelled events were also a frustration. So another example was that 1/4 of trainees had been due to present at a conference and that conference was then cancelled, and there were concerns about the knock-on effect of that applying for grid training and how that may impact points awarded in shortlisting as an example. So the other theme I'm going to talk about from the negative experiences is safety. Within this theme, there were 5 sub-themes, which are inadequate supervision, communication breakdown, inadequate PPE, inadequate staffing, and fatigue. So within the sub-theme fatigue, some trainees had real changes to their working patterns and used the word relentless to describe this at times. 1/5 of all trainees reported increased working hours during the pandemic, and 1/3 of all trainees had provided unplanned out of hours cover. Trainees had suggestions on how this could be improved upon, and that included where intense out-of-hours shifts were needed, and there was a recognition that that was needed. These should occur just for short periods, but not for months. And trainees also felt that they should try and avoid situations where there's an expectation to cover last-minute absences, and it frequently falls to the same handful of people. There were also concerns within the safety theme related to communication breakdown, and lots of trainees expressed having a mix of information presented to them, conflicting guidance with what PPE to wear and admission pathways, as an example from the quote you can see on the screen. And trainees felt kind of out of the loop with communication in many ways, and felt that this could be improved. One trainee said the experience would have been better if there had been more communication, even if that was just an explanation of decisions or uncertainty. However, it wasn't all bad. There were positives. When we asked trainees what their positive experience they'd had related to training, again, we found 4 themes within this part of the questioning. And the themes we identified were change practice, skill, teamwork, and extra time. Within the theme of changed practice, there were 3 predominant sub-themes, which were remote working, adopting innovation, and virtual learning, which I'll talk about now. Virtual learning was really valued for its availability and convenience. Trainees appreciated that they had reduced cost in terms of travel costs, parking costs, childcare, time cost, and they also liked the ability to catch up on teaching they might have missed, and that be available to them at a later date. And the large number of trainees in their comments suggested that they wanted this to continue beyond the pandemic and would find that useful. With virtual learning, trainees also had access to many other resources. So 28% of trainees had access teaching through national sources and 14% from international sources, which was new for them during the pandemic. And this was particularly noted for benefit by some of the societies that have smaller training numbers, and their teaching often involves more travel. Almost all, so 92% of trainees responding to the survey had attended virtual teaching. And for most trainees, they had attended this within either their paediatric or neonatal department or through their deanery. So I know this is a bit busy. Within the theme extra time, this was a real positive that was very kind of gone through in the responses from trainees. There were 7 sub-themes which are articulated through these example quotes, and I'll let you have a moment to read them. So for many trainees, the pandemic actually provided extra time for them to use their working hours more meaningfully. One trainee said, "I've definitely started to use my e-portfolio in a more reflective way. I've read around interesting cases, searched for relevant journal articles, and because they're interesting to me, I've gained a lot from this. Consequent to this extra time, my work-life balance has improved." An improvement in trainees' work-life balance and well-being, again, was frequently reported as a result of having extra time to do activities such as those you can see on the slide here. So how can we take this forward? The concerns regarding progression were most commonly related to the completion of work-based assessments. As they need to be, work-based assessments are kind of tailored to individual needs and expectations of the training unit. So it's probably most useful here to suggest that there's discussion between trainees and their assessors at regular points to try and help find solutions to this, and try and work out what the anxieties were that trainees had. You know, even though they weren't necessarily evident in the ARCP outcomes, it's still a worry for trainees. So I would turn that to all of you listening and ask you to think about what could work on your units. Perhaps a structured framework or timetable could help. What would trainees find helpful there? With extra time, the opportunity for supporting professional activities had a real positive impact on trainees, and they asked for this to continue. And so formal allocation of SPA time within rotas where it's not already included could also help with that. And then finally, virtual learning was really widely embraced, and trainees wanted to continue with that. There's quite a lot happening locally. I've got some resources there that you can see, and the website on the along the bottom is a list of responses. We asked trainees in the survey to let us know of any resources they'd found useful, which was a very long list, and they're across all subspecialties, and they're included on that page. So our results will hopefully be published shortly. We've submitted a draft manuscript to a journal, but in the meantime, please feel free to get in touch or ask any questions. And thank you to everyone that did the survey, put up with the harassing, and shared it and promoted it.
Brilliant, thanks very much, Jen. So I think that's something which is obviously important to all trainees, but also probably to all people working within child health, the sort of challenges that have been faced although they might be specifically different to different sort of groups, overall it's been a challenging time. So I guess one of the questions that, or one of the comments that we were just talking about was a lot of the trainees will have moved on over the last few months to a new workplace, and so taking forward what's been good about the initial phase of COVID to that new workplace and what we've learned would probably be a useful thing. One thing I wanted to ask, what do you think the sort of concern, not just from trainees, but from probably nurses, other allied health professionals, about redeployment into adult services? I know that for me, that was something I was a bit worried about, being made to go well with adults after having a long time not done that. I don't know whether you've got any specific feedback about that.
Yeah, so there were, I mean, there's quite a variety of experiences. Some things that trainees, said it's great, I have had loads of extra time, other trainees didn't get. There were concerns about redeployment. Actually, only 4% of trainees were redeployed to adult services, and for some of them, I think particularly PICU trainees, as an example, were, they were kind of recognised to have skills that would be useful. So there was some redeployment. Some trainees were also redeployed within paediatrics. So 18% of trainees remained within paediatrics, but were working in a different area with that. So it was a small proportion that actually did have to be redeployed.
Okay, so I guess it's reassuring for those of us who'd be a bit worried about being moved into a different area. The other thing that I was thinking about would be the sort of impact of COVID on other specialities, because obviously in paediatrics we've been fortunately a little bit shielded from the direct impact of COVID. Are there any other studies, or is there any other data out there about the impact, positive or negative, on specialities like, I guess, adult medicine, anaesthetics, that have been directly impacted primarily by COVID? I don't know if there's anything out there.
There's not much. So there was a kind of a brief survey done within Wessex of GP trainees, which there was a letter in a journal about that, and I think it seemed that there was slightly more redeployment with GP trainees, and I think that was kind of reflected in, because they already worked often within adult specialties within hospitals. But when we were doing this, there weren't any other published studies for other specialties. But the challenges we've had in paediatrics are quite different to that. And this, I've spoken about the impact on paediatric trainees, but we work with a whole range of healthcare professionals that have very different challenges with this. So it'd be interesting to compare. And I think just my own personal view, it's the extra time theme is possibly not something that would come through as a positive for other specialties. It would be interesting.
Definitely. I think it's really useful to sort of highlight some of the positives that have come out of it as well, because I think largely we focus on the negatives, but it's clearly not all negative. So that's perfect. I think that's probably everything from you, Jen. So thank you very much.